Sarafem, also known as fluoxetine, is used to treat depression, panic attacks, obsessive compulsive disorder, bulimia, and premenstrual dysphoric disorder. This medication may improve your mood, sleep, appetite, and energy level, and may help restore your interest in daily living. It may decrease fear, anxiety, unwanted thoughts, and the number of panic attacks. Sarafem may also reduce the urge to perform repeated tasks that interfere with daily living, such as hand washing, counting, and checking. It may lessen premenstrual symptoms such as irritability, increased appetite, and depression, and may decrease binging and purging behaviors in bulimia. The recommended daily dosage and optimal timing for taking Sarafem should be determined by a healthcare professional. Before taking Sarafem, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the morning. If you are taking it twice a day, your doctor may direct you to take it in the morning and at noon. If you are taking Sarafem for premenstrual problems, your doctor may direct you to take it every day of the month or just for the 2 weeks before your period through the first full day of your period. To help you remember, mark your calendar. If you are using the liquid form of this medication, measure the dose carefully using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well. Do not stop taking this medication without first consulting your doctor. Some conditions may become worse when the drug is abruptly stopped. Your dose may need to be gradually decreased. You should see some improvement in 1 to 2 weeks. It may take 4 to 5 weeks before you feel the full benefit. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Sarafem may include nausea, drowsiness, dizziness, anxiety, trouble sleeping, loss of appetite, tiredness, sweating, or yawning. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. However, if you experience any serious side effects such as changes in mental/mood, easy bleeding/bruising, muscle weakness, or seizures, it's crucial to contact your doctor immediately. Additionally, Sarafem may affect blood sugar levels, especially for those with diabetes. It is important to monitor your blood sugar regularly and share the results with your doctor. This medication may also increase serotonin levels and could cause serotonin syndrome/toxicity in rare cases. It is important to seek medical help if you develop symptoms such as fast heartbeat, hallucinations, severe dizziness, or severe nausea/vomiting/diarrhea. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours, which requires immediate medical attention. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Antidepressant medications like Sarafem are used to treat depression and other mental or mood disorders. They can also help prevent suicidal thoughts and provide other important benefits. However, it's important to note that some people, especially those younger than 25, may experience worsening depression or other mental symptoms when taking antidepressants. It's crucial to talk to your doctor about the risks and benefits of taking antidepressant medication, especially for those younger than 25, even if it's not for a mental or mood condition. If you notice any worsening depression, unusual behavior changes, or other mental or mood changes, such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, or impulsive actions, it's important to tell your doctor right away. Be extra vigilant for these symptoms when starting a new antidepressant or when the dose is changed. The daily dosage and optimal timing for taking Sarafem should be determined by your doctor based on your individual condition. Be sure to follow their instructions carefully. Before using Sarafem, inform your doctor or pharmacist if you have any allergies or if you are allergic to fluoxetine. It's important to discuss any medical history, especially if you have a history of bipolar disorder, suicide attempts, liver problems, diabetes, low sodium in the blood, severe dehydration, seizures, intestinal ulcers, or glaucoma. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana while taking Sarafem. The liquid form of this medication contains alcohol, so use caution if you have diabetes, alcohol dependence, or liver disease. It's also important to discuss any other medications or herbal products you are using with your doctor before having surgery. Children may be more sensitive to the side effects of Sarafem, especially weight loss, so it's important to monitor their weight and height while taking this medication. Older adults may also be more sensitive to the side effects, especially bleeding and loss of coordination, which can increase the risk of falling. If you are pregnant or planning pregnancy, discuss the benefits and risks of using Sarafem with your doctor. It may harm an unborn baby and can pass into breast milk, potentially having undesirable effects on a nursing infant. If you notice any withdrawal symptoms in your newborn, such as feeding difficulties or constant crying, tell the doctor promptly. Since untreated mental/mood problems can be serious, do not stop taking this medication unless directed by your doctor. It's important to discuss the benefits and risks of using Sarafem during pregnancy with your doctor if you are planning pregnancy, become pregnant, or think you may be pregnant. When taking Sarafem, it's important to be aware of potential interactions with other medications. This includes medications that can cause bleeding or bruising, MAO inhibitors, aspirin, and other drugs that increase serotonin levels. It's important to inform your doctor about all the medications and herbal products you are using before starting Sarafem. Sarafem can also affect the removal of other medications from your body, which may impact how they work. Additionally, it may interfere with certain medical tests, so be sure to inform lab personnel and your healthcare providers that you are taking Sarafem. If you are prescribed Sarafem, it's important to follow your doctor's instructions carefully and to ask about the best time to take the medication. This includes understanding any potential risks and benefits, as well as the appropriate dosage for your specific needs. If someone has taken too much Sarafem and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call for emergency help. In the U.S., you can reach your local poison control center at 1-800-222-1222. Residents of Canada can call a provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, severe dizziness, and fainting. It's important to keep all your regular medical and psychiatric appointments while taking Sarafem. This medication should not be shared with others. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take your next dose at the usual time. Don't take double the dose to make up for the missed one. It's important to store Sarafem at room temperature, away from light and moisture. Be sure to keep it in a safe place away from children and pets. When it comes to disposing of Sarafem, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. And don't forget to discard any expired or no longer needed medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.